Good morning, Big Mommy. It's so good to see you after a long period of time.
That's right. Good morning, Mummy Boluke. It's been a while since we last saw. How is everything and how about the family?
We bless God, we are doing well.
How about my friend, your daughter Masurat, my namesake? That do not like eating food, is she still like that?
Yes, oh, and guess what? I have concluded that she has eating disorder.
Harbar. How could you say a thing like that, or has she been diagnosed in the hospital?
I overheard someone on phone saying people who do not eat have eating disorder.
So what have you been doing about it? Have you gone to see a therapist?
No, I don't know anyone here, it's barely a week I relocated.
That's right. I think I know one pharmacist, a mental health expert that can explain better about this disorder. That is if your daughter truly have this illness. Anyways, I will call to book an appointment with her.
I'm really grateful. I feel relieved.
You are welcome, my dear. Come on, let's go and pay for the groceries.
Good morning. I am Baluk. My friend referred me to you. I have so many questions to ask about my daughter, but first let me apologize for my coming late. Good evening, apologies is accepted. I am Pharm Colette. Your friend told me the reason you wanted to see me. Before we proceed, where is your daughter? She is at home. She didn't want me to come here at all. So tell me, what's her name, how old is she? And since when did you notice this behavioral change in her eating habit? Her name is Masurat, she is just 10. Since she has been a child, she doesn't like eating. Then one day I overheard someone on phone saying those who don't eat have eating disorder. So I concluded she has. What? You mean you didn't go to the hospital so she can be diagnosed? Wow, you don't just conclude one has eating disorder. I will tell you a story now for you to better understand this disorder. Afterwards I will ask you some other questions. Miss Susie is a 19-year-old secondary school leaver brought to the hospital by her elder sister on the account of a 2-year history of refusing food and inducing vomit, claiming she is too fat, although with a progressive weight loss. She was apparently in a good state of health until 2 years prior to presentation, when she complains of being too fat. She subsequently started skipping lunch and later eating once a day. Sometimes takes pap, which she prepared watery without milk, or she could even take orange throughout the day. She maintained she was fat even when it was obvious that her shirts and blouse were appearing big for her. 8 months later, she was caught in the toilet inducing vomit with her finger. Her sister noticed the lady eventually go to the toilet to ease herself whenever she was forced to eat. Few months later, she was seen taking a white tablet. Pharmacist, please help me confirm which tablet is this? It's furosemide tablet. Thank you. The pharmacist confirmed the tablet. Susie confessed to have been using the tablet for 6 months. She claimed a patent medicine dealer gave her when she complained she has too much water in her body. The elder sister confirmed that since the onset of this strange behavior that Susie has been unusually cautious of what she eats. She would rather take lemon instead of Coke. She admitted her menstruation has been irregular but have not bothered because she has not had sexual intercourse for 1 year and she is not on any psychoactive substance. On examination, her weight was 42 kilograms. Body mass index 17.3. Her blood pressure is 95/60 mmHg and her pulse good. So now from this story, can you say your daughter has this disorder? No. She doesn't. You see, you don't need to bother yourself. These are questions I always ask my patient, and often I do tell them this particular story, most especially when they don't come with their children. You know what, I'm gonna recommend a multivitamin for her in a diet plan too. It will help. It's late already, I need to be in a meeting. Thank you so much.
Good morning, everyone. This emergency meeting was called in response to the misconception of patient anorexia. However, we have to educate all our staffs so as to have answer to the questions patient ask. Pharm Joy.
Yes, sir.
In our next meeting you will give a presentation on anorexia.
Okay, sir.
That will be all. You may now